Welcome to the deep dive. Today, we're going, well, beyond the usual checkup, straight into the world of oral surgery. And if you're here, you want the real scoop, fast and thorough. We've got the sources to do just that.
Yeah, we've looked at two really solid documents covering the basics, definitions, why your medical history is so critical, common procedures, sort of the foundational stuff.
Exactly. And our mission today isn't just reading them out. It's pulling out the key insights, maybe some surprises, so you get a much clearer picture of what oral surgery is all about and, why things are done a certain way.
Right. Let's jump in.
Okay, so oral surgery, first thought for many is probably pulling teeth, but it's way more than that, isn't it?
Oh, absolutely. Yeah, taking out teeth is part of it for sure. But the actual field, it's much broader. Think treating jaw fractures, dealing with TMJ disorders.
TMJ, that's the jaw joint, right?
That's the one, temporomandibular joint.
What?
Plus, things like bone grafts, tissue grafts, taking out cysts or tumors.
Wow.
Reconstructing deformities, even handling traumatic injuries to the face and mouth. It sort of bridges dentistry and, well, general surgery in a way.
Okay, see, that's already surprising. Not just wisdom teeth, then.
Not at all.
But you mentioned tooth extraction specifically. Is there a technical term for just that part?
There is, yeah. The sources call it exodontics, specifically the surgical removal of teeth.
Exodontics. Okay.
So exodontics is oral surgery. But oral surgery is much bigger than just exodontics. It's one piece of the puzzle.
Got it. That helps clarify. Now, before any of this happens, something called informed consent pops up everywhere in the sources. Why is that step so fundamental?
Well, informed consent isn't just, getting a signature. It's really about making sure you, the patient, fully understand what's being proposed. Like the benefits, sure, but also the risks, what the other options are. It lets you make your own decision about your body and your care. It's basic ethical practice, really, respecting autonomy.
Right, giving the patient the power through knowledge. Makes sense. Now, speaking of preparation, the medical history review. Both sources hammer this point home. It seems absolutely non-negotiable. Why?
Yeah, it really is. Think of your medical history as like the instruction manual for your body's health. Certain conditions dramatically affect how you might react to surgery, to anesthesia, even how you heal afterwards. Knowing that history lets the surgeon anticipate problems, adjust the plan, make things as safe as possible. It's amazing how linked everything is, Oral health and overall health.
Totally connected. Okay, let's dig into some specifics mentioned. A recent heart attack within 6 months, that's a big flag. What's the main worry there?
The interesting thing is the need to talk to the patient's cardiologist or main doctor first. Often, the concern circles around epinephrine.
Epinephrine. That's in the local anesthetic sometimes.
Exactly. It helps constrict blood vessels, but that can also make the heart work harder. And if someone's heart is already stressed from a recent attack, well, you don't want to add more strain, right?
Right. Makes total sense.
So that consultation determines if it's safe, maybe if the dose needs adjusting, shows how even a mouth procedure needs a whole body perspective.
Definitely. What about something like a heart murmur? Lots of people have those, sometimes without knowing.
That's a good point. For certain types of heart murmurs, there's this potential risk, an infection risk actually, called infective endocarditis.
Wow.
So the physician might say, okay, take antibiotics before the surgery. It's called antibiotic premedication. But, and this is important, it's not for all heart murmurs.
Okay.
It really depends on the specifics. Again, highlights why that detailed history is crucial.
So case by case. Similar logic, I guess, for joint or heart valve replacements within the last couple of years. The sources mentioned that too.
Precisely, yeah. Same thinking. Artificial joints, artificial valves, especially newer ones, can be sites where infections might settle.
Ah.
So, again, the patient's doctor will likely recommend those preventative antibiotics to minimize risk during any invasive procedure, oral surgery included.
Okay. Makes sense. Let's switch gears slightly. Diabetes, specifically insulin dependent. What are the precautions there?
Stability is key, right?
Yeah.
Blood sugar stability. The recommendation is generally for these patients to eat a meal before any longer oral surgery procedure.
Why is that?
Because a long appointment can mess with their usual eating schedule. And if you're on insulin, skipping meals can lead to hypoglycemia, blood sugar dropping too low, which is dangerous.
Right. Practical stuff. Coordinating surgery with meals and meds.
Exactly.
What about high blood pressure? Hypertension, I imagine that's a factor too.
Oh, absolutely. Uncontrolled high blood pressure. That ramps up the risk for serious cardiovascular events during or after surgery. Things like stroke or heart attack.
Scary.
Yeah. So the sources mention a target, Ideally, the diastolic reading that's the bottom number should be below 100 before elective surgery proceeds. It's a safety margin.
A clear line. Okay. And kidney or liver disease, how do they play into this?
Think about how your body handles medications. Kidneys, liver. They do a lot of the processing and clearing out. So if those organs aren't working at 100%, it can affect how drugs are metabolized. Could mean increased bleeding risk or needing different pain meds, maybe different doses of anesthetic. It's about not overloading those systems.
So it affects the medications around the surgery too. Pregnancy is also flagged.
Yeah, generally the first trimester is a no-go for non-emergency oral surgery. Too much critical development happening.
Okay.
Second and third trimesters, it's usually limited to urgent stuff only, minimizing any potential risk to the pregnancy.
Makes sense. And lastly, just current medications in general. Seems obvious, but what are the specific worries?
The big one is interactions. How one drug affects another.
Like the patient's regular meds interacting with the pain meds after surgery?
Exactly. Or even interacting with the local anesthetic used during the surgery. You need a really thorough check of everything. They're taking doses, timing, all of it to avoid problems.
Man, it's quite the checklist. It really drives home that even a simple extraction needs a deep dive into the patient's whole health picture.
It really does.
Okay, let's pivot a bit. Let's talk about some specific terms and procedures from the sources. First one, impacted teeth. What does that mean? Are there different kinds?
Yeah, so an impacted tooth is basically one that's stuck. It hasn't come into the mouth properly where it's supposed to be. And the materials break it down into two main types. There's soft tissue impaction. That means it's covered partly or maybe fully just by gum tissue.
Okay.
And then there's full bony impaction. That's more stuck. It's completely trapped inside the jawbone. How you treat it depends on which type it is and where it is.
Right, whether you watch it or take it out. Gotcha. What about frenectomy? Sounds kind of technical.
It does, but what's cool about a frenectomy is it's often a fairly small surgery that can make a big difference. A frenum is just a little fold of tissue connecting things in your mouth.
Like under your tongue.
Exactly, the lingual frenum under the tongue or the labial frenum between your lip and gums. A frenectomy just releases or removes that attachment.
And why would you do that?
Well, releasing a tight labial frenum, for instance, might help close a diastema.
Diastema. That's the gap between teeth, right? The sources mention that.
That's the one. And releasing a tight lingual frenum, the one under the tongue, can improve tongue mobility. Huge for speech or even for babies having trouble feeding. So, small thing, big impact sometimes.
Huh. That's actually fascinating. Okay, next term. Alveoplasty. Sounds like bone.
You got it. Alveo relates to the socket or ridge where teeth sit. Alveoplasty is basically reshaping or smoothing out that bony ridge.
When would you need that?
Often after taking out several teeth. It helps create a smoother base, maybe for dentures or implants later on, like prepping the foundation.
Okay, smoothing things out for what comes next. Now, something less positive. Alveolitis or dry socket. People dread that one.
Yeah, definitely want to avoid. Alveolitis or dry socket is basically when the blood clot that's supposed to form in the socket after an extraction gets lost or doesn't form right. Yeah, it exposed the bone and nerves. Very painful. And the sources point out common culprits. Rinsing too hard, spitting forcefully, smoking.
Yeah.
Basically anything that can dislodge that crucial clot in the first few days. Good practical advice there.
Definitely good to know what not to do. Okay, last one. Biopsy. Common medical term, but in oral surgery.
Same principle. If there's an unusual spot or lesion in the mouth, a biopsy means taking a small tissue sample from that area.
And sending it off.
Exactly. Off to the lab for analysis under a microscope. It's how you find out what's going on. Is it benign? Is it precancerous? Is it something more serious? It's a key diagnostic step for getting the right treatment started quickly.
Okay. Wow, we've covered a fair bit then. We started realizing oral surgery is this huge field jaw repairs, tumors, not just extractions. Then we really saw how critical that medical history is, how things like heart conditions or diabetes totally change the approach.
Absolutely vital.
And then we decoded some of those terms like impaction, frenectomy, dry socket, understanding what they actually mean.
Yeah, I think pulling from these sources really shows you it's a complex specialty. It demands, a real grasp of the patient's whole health picture, plus all the specific surgical know-how and potential issues.
Definitely gives you a new appreciation for it all.
It's a testament to how interconnected our bodies are, isn't it?
Yeah.
And the level of care needed.
For sure. So here's something to leave you thinking about. Just consider how deeply connected a patient's entire health story, every little detail is, to planning even what seems like a simple oral procedure. What other maybe hidden factors might be shaping medical treatments in ways we don't always see?